This is our research poster titled Medication-Induced Xerostomia Relief, which is more effective, by Lexi Brial, Cynthia Elliott, Matthew Cassidy, and Tanya Gupta. Introduction. This is regarding case study H, where the products for relief of drug-induced xerostomia for the patient. Our PICO question was, in patients with xerostomia, will saliva substitute gels compared to dry mouth spray be more effective in relieving xerostomia? So some treatments for options for xerostomia are prescription medications that can increase saliva production, or over-the-counter products that give temporary relief like gels, sprays, mouth rinses, or gums. And something that shows that it's very important for the relief of xerostomia is it reduces the incidence and severity of oral diseases, as dry mouth can exacerbate the symptoms of oral disease. Furthermore, it can eliminate patient discomfort. And lastly, xerostomia is a leading cause of dental decay, so this will reduce this.
All 4 of the articles reviewed were found using the database PubMed. The 3 filters that were applied were advanced text, free full text, and then within the past 10 years, which was 2012 to 2022. These were the search terms and Boolean operators used. The first one was found using the systematic review. The second and third were found using the randomized controlled trials, and the fourth was used for the meta-analysis. The only Boolean term operator used in this search was AND.
Here are the results extracted from each article.
The first article is of a randomized control trial comparing the efficacy of xerostomia relief for multiple types of oral mouth sprays. The trial found that DC161-DP0292, which was an aqueous oral spray, produced the faster onset and reduced xerostomia symptoms the most. But it also found that the comparative mouth spray had very similar levels of effect on dry mouth.
The next study is regarding the efficacy of gum hydrol versus biotin in oral balance mouthwashes plus gels for symptoms of medication-induced xerostomia. There were slight differences between the 2 saliva substitutes, but gum hydrol had the most similar effects on decreasing the consequences of dry mouth. And as you can see by this graph, the VAS was reduced from 80 to 60, and the VAS is a scale of how severe the xerostomia is, with 0 being the least and 100 being the worst.
The next result came from the systematic review, which focused on the efficiency of artificial salivary substitutes. These results came from drug-induced xerostomia, which found that oral sprays DC161, DP0292, Aquacil, and 3% citric acid had the most beneficial effect on drug-induced xerostomia due to the active ingredients.
And the last article was a meta-analysis, and the graphs here explain how well the saliva substitutes enhance salivary production based on 2 factors: the mass adsorption, which is the measure of the binding ability between the salivary conditioning film and the salivary substitutes, to enhance the structural softness, which is how well the film is lubricated by the substitutes. When both these factors are taken into consideration, it can create a better relief period, another word for the non-xerostomia period. And the main active ingredients that yielded results of highest efficacy were carginin, CMC, carbomer, porcine gastric mucin, and xanthan gum.
So from these results, we determined that the null hypothesis was accepted, which says that there's no significant difference between the efficacy of saliva substitute gels and dry mouth sprays at relieving xerostomia. The RCTs were limited by their data collection because they used the VAS, which is the visual analog scale, which is a questionnaire that yields subjective data, which limits the clinical significance. The systemic review stated that potential bias may have been from unpublished literature not being included in the study, and the meta-analysis authors stated that there was no conflict of interest and that they conform to all ethical guidelines. So as I said, the results of these studies support the null hypothesis by providing the data that suggests the mode of application is not impactive of the efficacy of xerostomia relief. It is concluded that the active ingredient of the product has the significant impact on efficacy. Further trials which compare the mode of application and efficacy with clinical significance could change this conclusion. And these are the references for the articles that were found for this literature review. Thank you for watching.